Hi there, it's me again, John. Thank you for joining me. For this clip, we will talk about pharmacology. I know that I guess this concept is the most hated concept by all nurses, maybe because of its complexity, right? You try to consider if the patient takes a certain medication, you have to consider, okay, the action of the medication. Why is that drug given to your patient? Am I right? What are effects of that medication? The local effects, the systemic effects. Am I right? You have to consider as well as the drug interactions, and not to mention you have to consider your nursing responsibilities there, making sure that you have to give the medication to the right patient at the right time, right dose, etc. Right? So you have a lot of things to consider when you talk about giving medications to your patient. Am I right? That is why maybe because of that complexity, this is the most hated concept. But don't worry, because we will try to simplify pharmacology for this video clip. Those are things that you need to remember if you're planning to take any qualifying examination. Okay, so to start, let's try to define what is pharmacology, as well as we'll try to simplify what do you mean when you say onset, peak, duration, withdrawal symptoms, toxicity, hypersensitivity, what else, trough, what else, hypersensitivity, I said that, and half-life. Okay, so let's begin. What is pharmacology? Pharmacology is actually a branch of medicine that focuses more on the use of the drug, the action of the drug, and the effects of the drug. Okay, so let's write it down. So what is pharmacology? Pharmacology refers to a branch of medicine that deals on uses, actions, and effects of the drug. Okay, so when you say effects of the drug to the patient's body, okay, maybe a local effect or systemic effect. Okay, so that is what we call pharmacology. It's a branch of medicine. Okay, so I want to emphasize more here effects of the medication. Okay, so you say effects of medication, there's such thing as what we call desired effect, side effect, and adverse effect. Okay, let's try to define these three words. Now, what do you mean when you say desired effect? What do you mean when you say side effect? And last is your adverse effect. Okay, so when you say desired effect, you also call this as your therapeutic effect or intended effect. So this is an effect, okay, that the medication is supposed to do to your body. Okay, that is the desired effect or your therapeutic effect or intended effect. Let me give an example. When you're taking an antipyretic drug, in short, it is a drug that will lower your temperature. It is a drug given to patient with fever. So what is the desired effect of the drug? That drug is expected to decrease your fever, decrease your body temperature. That is the desired effect. Okay, another example. If the medication is an antibacterial, it kills the bacteria. So what is the desired effect? To kill the bacteria. Or if it is bacteriostatic, it limits the multiplication of the bacteria. So that is the desired effect. Okay? So other than that, if you have unwanted effect of the medication apart from your desired effect, you call that as your side effect. Again, what is side effect? Side effect or side effects are unwanted effects of the drug. Unwanted effects of the drug, it could be minor effects or an effects that are harmful to the patient. If that side effect is harmful to your patient, that is what we call adverse effect. So what's the point? Adverse effect is an example of your side effect. What makes it adverse effect is that it is a type of side effect that causes harm to your patient. Okay? Let me give you an example. Let's say that this medication is an antibacterial drug. Okay? An antibacterial. The desired effect of this drug is that it kills the bacteria. That is the desired effect. When you take this drug, it causes GI upset. That is the side effect. That is why to prevent GI upset, that side effect, GI upset, what will you do? Take the drug in full stomach. Take that with meal. That will prevent GI upset. The adverse effect of this drug is that this drug causes nephrotoxicity. In short, it causes kidney damage or kidney problem, which is harmful to your patient. Okay? That is why if your patient takes this medication and develops increased BUN, increased creatinine, patient has oliguria, patient has renal dysfunction, will you notify the doctor about that? Yes, because that is a form of an adverse effect. But if the patient takes this drug and develops GI upset, okay, is there a need for you to notify that immediately to the doctor? No, because that is just a side effect. It is unwanted but not harmful. All you have to do there is to tell the patient to take the drug with meal or full stomach. Will you tell the doctor or notify the doctor that the bacteria now is decreasing in its number, or the bacteria or the drug taken by the patient killed the bacteria? No, because that is the side effect. Therefore, in your qualifying examination, okay, do not notify the doctor if that effect is the side effect or side effect, except if that is adverse effect. Make sense? Okay, just to recap. Okay, the side effect, you also call this a sure therapeutic effect or intended effect. This is the effect that the drug needs, okay, or supposed to do to your body, or supposed to do. That is your side effect. Side effect refers to unwanted effects of the drug. If these unwanted effects are harmful to your patient, that becomes adverse effect. Okay, so again, notify the doctor if the type of effect present to your patient or patient exhibiting is a form of an adverse effect. Okay, I hope those are things clear. Next, another terminology you need to remember will be the onset, the peak, trough, and duration. Okay, so you have your onset, so have your peak, trough, and duration. Okay, let's try to define this four words first. Now, what do you mean when we say onset? Onset is the time when the drug takes an effect. Again, onset is the time when the drug takes an effect. That's the onset. What about peak? Peak is the time when the drug reaches its maximum concentration in the body. Again, peak is the time when the drug reaches its maximum concentration in the body. That's your peak. Trough refers to the time when the drug reaches its lowest concentration. Again, the time when the drug reaches its lowest concentration. That's your trough. What about duration? Duration refers to how long is the effect. Okay, how long is the effect? Now, for us to better understand these terminologies, it is best illustrated this way. Sorry. Okay, so for example, you take the drug. As you take the drug, okay, of course, it will undergo several processes in your pharmacokinetics, am I right? So the body will absorb the medication. Once absorbed, it starts in effect. So this part here is the onset, okay? Time when the drug takes an effect. As the body absorbs the medication, that medication now increases its concentration in the plasma in the body. Gradually, it increases until such time that drug reaches its maximum concentration. We call that as peak of the drug. Again, peak is the time when the drug reaches its maximum concentration in the body. Then, of course, after it reaches its maximum concentration, the body now, the kidneys will get rid of it gradually. Am I right? So the body now will try to eliminate that medication. So gradually now, that concentration will decline or decrease. So as it decreases, okay, the plasma concentration of the drug decreases until such time it reaches its lowest concentration. That lowest concentration is what we call trough. So again, trough is a time when the drug reaches its lowest concentration. Therefore, the opposite of peak is your trough. Okay, the opposite of peak is your trough. That is why, okay, when that thing happens, okay, when the drug reaches its lowest concentration, it is bad for you now to take the next dose, so that there's continuation of the medication. Am I right? That explains why in your NCLEX sometimes you'll encounter there, when is the best time for you to get blood to check trough of the medication? Common medication used here is your vancomycin. Okay, so the question goes like this. When is the best time to check blood for vancomycin trough? Okay, when is the best time to check blood for vancomycin trough? Your answer there will be 30 minutes before giving the next dose. So for example, the next dose will be 8 o'clock in the morning. When is the best time to check blood for vancomycin trough? That will be 7:30 in the morning. In short, 30 minutes before giving the next dose. Okay, 30 minutes before giving the next dose. Okay, so from this point here, onset going here, this is what we call the duration. How long is the effect? Okay, how long is the effect? Now, just to recap, onset is the time when the drug takes an effect. Peak is the time when the drug reaches its maximum concentration. If you incorporate this in your examination, particularly with your insulin, remember, if you will be asked in your examination, regular insulin was given at 7 o'clock in the morning, what time you would expect that there is a decrease in the sugar level? Remember, the question there, it's asking you what time you will expect that there is a decrease in the sugar level. It's not asking you what time you will expect hypoglycemia. So if in your examination you'll be asked what time you will expect that there's a decrease in the sugar level, you check the onset of that insulin, okay? Because that is the time when the drug takes an effect. So if the drug now takes an effect, you will see that there is a decrease in the sugar level, but not necessarily hypogly. Because when you say hypogly, you have to check the parameter there, the peak of the insulin. Why? Because the peak refers to the maximum concentration. That is where most likely hypoglycemia to occur. So again, if you be asked in your examination about time you will expect a decrease in the sugar level, you use the onset of insulin. But if you be asked in your examination what time you will expect hypoglycemia to occur, then you will use the peak of that insulin. Okay? Hope these things are clear. Okay? So again, onset refers to the time that the drug takes an effect. Peak refers to the time when the drug reaches its maximum concentration. Trough refers to the time when the drug reaches its lowest concentration. Okay, duration refers to how long is the effect. Remember, not all medications will have the same onset, peak, and duration. Okay, and trough. Just a point to remember. Okay, next. Apart from this terminologies, there are also things you need to remember, like the side effect. Another term you need to remember will be toxicity. Okay, then we also have hypersensitivity. Then we also have here your withdrawal symptom. Now let's begin with toxicity. What is toxicity? Toxicity refers to a condition wherein the patient consumed more than what is allotted dose of the agent. Okay, again, sorry. Toxicity refers to a condition wherein the patient consumed more than what is the usual level or dose of the medication. Now, there are a lot of things to consider when you talk about toxicity. Now, what are those? You have to consider the age of the patient, right? You have to consider the overall health condition of the patient, because if the patient has a renal dysfunction, if a patient has a liver dysfunction, then most likely they are prone for drug toxicity. Why? Because if you have renal problem, the excretory function of the kidney is affected. As a result, the body now cannot get rid of waste products. Same with drugs, okay? And of course, if you have a liver problem, remember the liver plays a vital role for detoxification. Therefore, if that process is affected or impaired, then it will also increase the risk of toxicity, okay? The risk of toxicity to the medication. That is why we have to be cautious, be careful when giving medications to patient with liver dysfunction or renal dysfunction, because incidence of toxicity is very high. That is why the doctor tells you you have to give this drug at this specific time, at this dose, then you have to follow that. We cannot bombard the patient with a lot of medications, with a lot of drugs, because the ability of the kidneys to get rid, ability of the liver to detoxify is affected. Then again, toxicity, the risk of toxicity also increases, okay? Apart from that, another thing to remember about toxicity will be electrolytes. Remember, there are electrolyte imbalances that will increase the likelihood of toxicity. One good example here is your potassium and then your digoxin. Remember, if your patient takes digoxin, digoxin, this is digoxin, it's a form of a cardiac glycoside. It is a form of digitalis. This is the drug of choice for congestive heart failure, okay? Now, if your patient takes this medication, your digoxin or digoxin or lanoxin, you have to closely monitor the potassium level of your patient, because if there's a decrease in the potassium level in the blood, or you have hypokalemia, a decrease in the potassium level will increase the effect of digoxin, or in short, hypokalemia potentiates the effect of digoxin. As a result, it increases the risk of toxicity. Okay, see, there are electrolyte imbalances that will also increase the likelihood of the person to have toxicity. Okay, so again, what is toxicity? It refers to a condition wherein the patient takes more than the usual dose of the medication. Okay, now what about hypersensitivity? Hypersensitivity refers to a reaction, okay, that will occur when the patient responds to the drug aggressively, where a normal person will not respond that way. Again, hypersensitivity refers to a reaction wherein the patient's body responds to the drug violently or aggressively, where a normal person will not respond that way. Let me give you an example. Let's say I am the person who is hypersensitive or allergic to penicillin. Regardless of the dose of your penicillin, okay, even a small dose of penicillin, if I am exposed to that dose, to that penicillin, regardless of the dosage, regardless of the volume or amount, my body will react violently. My body will react aggressively. That is hypersensitivity. But to a person who is not allergic to penicillin, if expose that same allergen, same medication, same agent to a person, that person will not respond violently. I respond violently, so I am hypersensitive to the medication. Just remember that the higher the dosage of the drug given to your patient, then the more severe will be hypersensitivity reaction of the patient. Okay, same with your blood transfusion. If you can still remember, in your blood transfusion, on the first 15 minutes of your blood transfusion, the running rate of blood is kV or rate, right? Because the more blood transfused to your patient, the more severe will be the allergic reaction. Okay, that's your hypersensitivity. Now, what about withdrawal symptoms? Withdrawal symptoms refers to a group of signs and symptoms, and it also includes psychological features of the patient that the patient will manifest if there is discontinuance of the medication. So if the patient stops taking the drug, okay, if the patient stops taking the drug, the patient manifests withdrawal symptoms. So when you say withdrawal symptoms, these are signs and symptoms and psychological features that the patient will manifest when the patient stops taking the drug, wherein that patient is dependent to the drug. One good example there is your opiate. Therefore, if I am a patient who is dependent to an opiate medication and I will stop the drug, I will stop opiate, I will develop withdrawal symptoms. So withdrawal symptoms will involve, okay, physical and psychological features, okay, because there's discontinuance of medication. What I want to remember, okay, what I want you to remember in your examination is that with respect to withdrawal symptoms of your patient, withdrawal symptoms are the opposite of the desired effects of the medication. Let me give an example. For example, the medication can cause bradycardia, okay? For example, okay, the medication causes bradycardia. This is the effect of the drug. But the moment you will have withdrawal symptom, in withdrawal symptom, there will be tachycardia. Okay, so this is why, so don't confuse yourself. In withdrawal symptoms, these are the total opposite of the effect of the drug. Okay, so don't forget that. So these are common terminologies you need to remember in your examinations. Okay, so you have your desired effect, side effect, adverse effect, onset, peak, trough, duration, toxicity, hypersensitivity, withdrawal symptoms. Okay, then after this, we will talk about pharmacology per system. Okay, so I will enumerate and discuss what are common drugs that you will encounter if your patient has neurologic disturbances, endocrine disturbances, right? So we will discuss pharmacology per system. But prior to that, of course, I will write down common conversions you need to remember in your exam, plus formulas as well. Okay, so I hope you learned something on this introduction. Let's proceed to the next clip, wherein we will talk about, okay, conversion and common formulas you need to remember for your exam. Okay, God bless everybody and see you in the next slide. Bye.